Good afternoon, everyone. My name is Bo Han from Amgen, and welcome to the Town Hall presentation of what biomarker testing means for patients diagnosed with metastatic colorectal cancer. This program is being presented on behalf of Amgen, the sponsor of this program, and is being presented in accordance with Amgen's compliance program as well as FDA regulations. This is an educational program and should not be construed as a presentation that any specific therapy might be safe or effective in treating any particular disease. This program has been developed as a collaboration between the Colon Cancer Alliance, KRAS for Life, and Fight Colorectal Cancer Organization. Now I welcome our moderator, Kevin Bergerson from Colon Cancer Alliance.
Thanks, Bo. Hey, my name's Kevin. I'm the Patient Education Program Senior Coordinator for the Colon Cancer Alliance. Also with us are Erica Brown, founder of KRAS for Life's Colon Town Community of Support, and herself a colon cancer survivor, as well as Kevin McCabe, who is the Community Resource Manager for Fight Colorectal Cancer. It is my pleasure to introduce Dr. Christopher Liu, Assistant Professor and Director of the Colorectal Medical Oncology Program. Dr. Liu is a member of the Developmental Therapeutics Phase 1 clinical trials and Gastrointestinal GI Medical Oncology Program. These comprehensive programs include multidisciplinary cancer clinics, tumor boards, and research endeavors. Dr. Liu is interested in resistance mechanisms to targeted therapy in GI cancers, and he was awarded the Conquer Cancer Foundation Career Development Award to study targeted therapies in colorectal cancers. And with that, I'm going to turn the webinar over to you, Dr. Liu.
Well, thank you, Kevin, for that very kind introduction. Again, my name is Chris Liu. I'm one of the GI medical oncologists that specialize in colorectal cancer. And I serve as the Colorectal Cancer Medical Oncology Director. It's an honor to talk to you all today about getting tested and knowing your biomarker and what biomarkers might mean for you and your treatment plan. So one of the great advances in the treatment of all cancers is this concept of personalizing therapy to treat metastatic colorectal cancer or to treat cancer in general. And what we mean by personalized medicine is this concept of individualizing your medical treatment plan to identify people that may be more likely to benefit from a particular treatment plan, or may identify patients that are at greater risk of adverse events from one particular treatment plan versus another. In terms of our physicians treating our patients, if we take 10 patients with metastatic colorectal cancer, we shouldn't be too surprised if we have 10 patients who are all very different, whose tumors may have different biomarkers, different mutations. We shouldn't be surprised as patients or physicians when sometimes our treatments work really well for cancer and sometimes our treatments don't work at all for cancer. And so that's why this concept of trying to figure out what makes each patient's tumor unique and personalizing a treatment plan based off those characteristics can be such a big step forward in terms of treating cancer. And we've really seen this come true and come to life over the last 10 years. I want to talk about medical treatment plans. Medical treatment plans for metastatic colorectal cancer can include several different things, and there are two main points that I want you to take away from this slide. The first one is that your treatment needs to be multidisciplinary. And what I mean by that is that you want doctors from several different subspecialties weighing in to create a treatment plan specifically designed for you. That treatment plan might include surgery. You know, previously we believed that when a cancer had spread to other organs, that we shouldn't do surgery. However, we know now that there is a minority or a small group of patients with metastatic colorectal cancer where we can employ a combination of several different treatments, including surgery, to actually improve survival. And the most common type of surgery that we use for metastatic colorectal cancer involves cutting out tumors in the liver, but surgery is of course employed in several other situations as well. Radiation can be an integral part of treating metastatic colorectal cancer. Oftentimes we use radiation to improve symptoms, but sometimes radiation can be used more curatively as well. The second main take-home point I want you to get out of this slide is the concept of chemotherapy versus targeted therapy, because we now employ both of those treatments to treat metastatic colorectal cancer. And I want to also address the fact that chemotherapy and or targeted therapy is also the most common treatment that we use for metastatic colorectal cancer. When a cancer has spread to other parts of the body, we need a treatment that can go to other places in the body as well. And that's what chemotherapy and targeted therapy do. Chemotherapy is a type of cancer treatment that works by killing rapidly dividing cells. And these are the cells that are found in cancer. A targeted therapy is a more targeted type of cancer treatment that works by targeting specific genes or proteins that are altered in cancer cells. And a lot of times we can use targeted therapy by itself, but we also know that sometimes targeted therapy in combination with chemotherapy can be effective as well. So the title of this webinar is Knowing Your Biomarkers. So what do we mean by biomarkers? What are biomarkers? So in short, biomarkers are short for biological markers. They're biological molecules that are found in blood, other body fluids or tissues that may be measured to provide information about your tumor. So once you test for biomarkers, the results of that biomarker test can indicate whether a cell function is normal or not normal. It can provide some insight into the likely outcome from a cancer if it's left untreated. And a lot of times, you'll hear doctors describe this as prognosis. How aggressive is the cancer, and can biomarkers help us with that? Biomarkers can also predict the likelihood of a cancer's response to a specific treatment plan or a lack of response to a treatment plan. So is our treatment plan going to be guided by this biomarker? And the most important part of this slide is the bottom. We want biomarker testing to be able to help you and your doctor make decisions about care. That's the most important part of this slide. And the reason why is getting more information is always good, but we want to be able to act on that information. Will the information help us select a specific treatment plan that may help you, or can it help us guide to not use certain treatments? The schema from this slide kind of goes over what you might find from biomarker testing. So if we take a group of patients all diagnosed with the same disease, metastatic colorectal cancer, and we do biomarker testing, and oftentimes biomarker testing can be done on tumor that's already been removed from the body. This can be either from a prior surgery or from a prior biopsy procedure that helped you get the diagnosis of metastatic colorectal cancer. When that biomarker testing is performed, you may end up being biomarker negative, and your doctor may describe this as being wild type. And doctors sometimes use a completely different language, and essentially when they say that a gene or a biomarker is wild type, what they're essentially saying is that there's no mutation there, and we would oftentimes consider that to be biomarker negative. And so those patients with metastatic colorectal cancer are now, you see colored in green, and they're biomarker negative. You might do the biomarker testing and you might end up with a positive biomarker. And oftentimes doctors will say, well, this biomarker or this gene is mutated, or it's mutant. And what this means is that the gene is not normal, there's a mutation there, and we may consider this to be biomarker positive. And again, the most important part of this is that knowing your biomarker status can help you and your doctor decide on which treatment plan may be effective for you, and to also avoid treatments that may not work for you, where you may only get side effects. I want to talk about some of the commonly tested biomarkers that people talk about when they discuss biomarkers for colorectal cancer. So some of the most commonly tested biomarkers for metastatic colorectal cancer are genes in the RAS family, and that includes KRAS and NRAS, and also a gene called BRAF, and these may be important in terms of selecting treatment plans for patients with metastatic colorectal cancer. So I want to talk about the most commonly tested genes, and I want to talk about RAS and RAF. So the RAS genes, which include KRAS and NRAS, are actually frequently mutated in patients with metastatic colorectal cancer. About half of our patients with metastatic colorectal cancer will have mutations in RAS, which leaves the other half of patients with metastatic colorectal cancer to have no mutation in RAS, and that's what they mean by wild-type tumors, RAS wild-type tumors. So RAS includes a family of genes that includes, of course, the genes KRAS and NRAS. And the RAS biomarkers can provide some information that may inform your treatment plan, as well as therapies that may or may not be appropriate for you. So patients without mutated RAS genes in their tumors, and again, these are called wild-type or RAS wild-type tumors, they may be more likely to respond to certain treatment plans, while those with mutated RAS genes in their tumors may respond poorly to certain treatment plans. So by testing for RAS, you and your physician may have more information to select the best treatment plan for your particular tumor. I also want to discuss a BRAF mutation. So unlike RAS mutations, which are found in half of our patients with metastatic colorectal cancer, only 5 to 10% of patients with metastatic colorectal cancer, so a minority, have a BRAF mutant tumor or a mutation in BRAF. Why this is important is because patients with colorectal cancer that have BRAF non-mutant tumors or BRAF wild-type tumors may have a better survival compared to patients with mutated BRAF or BRAF mutant cancer. And why this is important is because it gives us prognostic information. It gives us maybe a better idea of the aggressiveness of the cancer, and that can be helpful for the patient and the physician as well. All right, so knowing your biomarker status. Again, one of the things that we don't want to do anymore is a one-size-fits-all strategy. As we move forward in terms of knowing more about cancer, knowing more about biomarkers, we want to be able to personalize treatment for patients. And so we know that each patient's genetic makeup of his or her tumor is unique, okay? So knowing your biomarker status, the genetic structure of your tumor, may help you and your doctor select an appropriate treatment plan. And so, on this slide, this bottom part is the one that I want you to remember from this webinar. So as a patient that has metastatic colorectal cancer, you and your caregivers, the people who are around you, are encouraged to start or keep an open dialogue with your doctors to stay current on genetics and what this means for your treatment plan, which means that as a patient or as a caregiver, it is okay to ask your doctor about this. And in fact, we are encouraging you to ask your doctor about this. So which gets on to our next slide, and that is to speak with your doctor. And as somebody who treats a lot of patients with metastatic colorectal cancer, I'm personally asking you to speak up about this because this helps physicians have a better and higher level discussion with you about your cancer and what biomarkers mean to treat your cancer. So please talk to your doctor about biomarker testing. If you've been recently diagnosed with metastatic colorectal cancer, start the conversation now. Ask about biomarkers. If you were diagnosed years ago with colorectal cancer, that's also a good time now to ask about biomarkers so that you can make an informed decision regarding treatment plans. Remember, as the patient, you are the boss, which means that no decision gets made without you, and you are in charge, all right? So ask your doctor whether your tumor has been tested for biomarkers, and if your doctor says yes, it's important to ask your doctor, what does the biomarker status of your tumor mean for you and your potential treatment plan? If the answer is no, you should definitely ask your doctor, will your tumor be tested and when? And it is okay to ask, and we are encouraging you to ask. So ask your doctor how these biomarkers may affect you and the treatment that you may receive in the future. All right, to summarize, the first point, personalized medicine is advancing, and I'll tell you that we're probably still in the infancy of what we know about colorectal cancer, but the more we know and the more we know about biomarkers, the better and more personalized our treatment will be. So for patients that have a diagnosis of metastatic colorectal cancer, biomarker testing is an important tool that can be used to individualize your treatment plan. The biomarkers that I went over are the most common biomarkers that we test for in colorectal cancer, and that includes RAS, which includes the genes KRAS and NRAS, and BRAF, and these biomarkers may be important in metastatic colorectal cancer. Knowing your biomarker status can help you and your doctor make extremely important healthcare decisions, and the last point is the one that I hope you come away from this with, and that is to speak with your doctor about your biomarker status. We do want you to ask, we expect you to ask, and I think that ends up having a positive effect on not only the relationship with you and your physician, but it also helps give you more information and empowers you to make good decisions for yourself about your cancer and your treatment. Well, thank you everybody for your attention. I'm actually going to hand this over to Kevin Bergeson to start our Q&A session.
Thank you, Dr. Liu. At this time, our hosts have some questions for Dr. Liu. We've reached out to Christopher Life's Fight Colorectal Cancers and the Colon Cancer Alliance's communities of metastatic colorectal cancer patients and caregivers, and have received a number of questions patients would like to have answered. I'd like to open it up to our host to present just a few of those questions.
This is Erica Brown from Christopher Life in Colontown. Dr. Liu, is metastatic colorectal cancer biomarker testing a blood test? Or will I need another biopsy?
So that's a great question, Erica. Biomarker testing for colorectal cancer is currently performed on tissue that we get from the tumor. And so this can be from a surgery, if you've ever had a surgery to remove part of your tumor, if you've had a previous biopsy, and sometimes the testing can even be done on needle biopsies of your tumor. That can be used for biomarker testing as well. On certain occasions, another biopsy may be needed to collect more tumor tissue in order to do the testing, but your doctor will be able to tell you which option may be right for you. But oftentimes, another biopsy is typically not needed.
Do I need to interrupt my treatment to be tested?
The certain mutations that we can identify through biomarker testing can predict whether a tumor is likely to respond to a specific treatment plan or not to respond to a specific treatment plan. So obviously, it is important that biomarker testing is done on your tumor before beginning these treatments. In some cases, testing may cause a slight delay or an interruption in your treatment plan, but that is typically a short delay. Your doctor will help you decide what may be most appropriate for you. But I will tell you, especially from personal experience, that oftentimes testing can be done without any delay or interruption in your treatment, and they can often be done concurrently or at the same time. And the testing can often, again, be performed on tissue that's already been taken and stored by either an office or a hospital.
Hi, Dr. Liu. This is Kevin Maccabee from Fight Colorectal Cancer, and I just had a question about where do patients get a biomarker test done?
So it's a great question. In order to get biomarker testing done, your doctor will definitely help you with that decision. Biomarker testing is specialized and is performed at accredited hospital labs. So depending on your location, it may be necessary to actually send the testing out to an outside accredited specialty lab. Your doctor can also order biomarker testing from one of these labs or at their own lab within their own hospital. But if the testing is done from an outside lab, those results will be sent to your doctor, and your doctor will give you those results.
Okay, great. And then how long does it take to get the results?
So most biomarker results are available about 1 to 3 weeks after the test is ordered. Some results can take up to 6 weeks, but that's a pretty rare occurrence. The exact time that it takes to get the biomarker test, of course, varies on the type of test that's being performed and where the test is being performed. If the test is being done locally, oftentimes the results can be a little bit shorter. If there's some time that needs to be taken to send the test to an outside specialty lab, that may sometimes increase the time a little bit. But of course, ask your doctor. As your medical oncologist will certainly have a lot of experience with this and can give you more details in terms of how long the biomarker testing will take for you.
Thank you.
Dr. Liu, Kevin Bergeson again with the Colon Cancer Alliance. How accurate is the test?
So the results can vary depending on the specific method of testing and the specific biomarker that you're actually testing for, but I am happy to report that when we've done studies looking at the accuracy of biomarker testing, particularly RAS biomarker testing, it's shown that it's typically 98 to 100% accurate.
That's incredible. And how much does this cost?
The biomarker testing is now for colorectal cancer is now covered by most major insurance providers. Obviously, there can be a lot of variability in that, but certainly we encourage our patients to contact either their insurance or more oftentimes their healthcare provider to determine what their costs will be for their for a patient-specific insurance plan.
Thank you, Dr. Liu. And with that, we are out of time this evening. Thank you, Dr. Liu, again. That was an amazing presentation full of useful information for our attendees this evening. As a reminder, about this time tomorrow, all the attendees will receive a feedback survey email regarding the webinar. We appreciate your feedback and encourage you to complete the survey when you get the link. On behalf of the Colon Cancer Alliance and the CRISPR Life and Fight Colorectal Cancer organizations, as well as tonight's presenter and Amgen, I'd like to once again thank everyone for attending this webinar town hall. I hope you found it informative and value added. Talk to your doctor for more information. Good evening and take care, everyone.